Good morning, everybody, and welcome to this Thursday morning webinar series. I'm Chloe Tetro, the health coach, here with Ready Care. For this morning, we'll be looking at spotlighting on hypertension, basically giving an overall explanation as to what it is, what it causes in the body. We'll look at the insulin connection, and finally, we'll look at foods that can help or hinder hypertension. So, hypertension is a word that I suppose most of us are fairly familiar with, but what does it actually mean? It is high blood pressure. It means the force of blood pushing against your artery walls is essentially what the hypertension blood pressure means. So it's measured in milliliters of mercury, so mmHg. So if you ever see that in a report, that's what that means. And it's given us two numbers, for example, 120/80. So the top number is the systolic number, and that's the pressure when the heart beats. And the bottom number, diastolic, is the pressure when the heart relaxes back down. So according to health guidelines, a normal adult blood pressure is around that 120 to over 80, or a little bit lower. So it can vary within that range, but not too much and not too low. So it's usually defined as readings above 140 and 140 over 90 then would be readings considered hypertensive readings. So in practical terms, if your blood pressure stays above this 140, above this 140, above 90 threshold, your doctor would likely diagnose elevated blood pressure or hypertension. So it's often called a silent killer because it typically causes no symptoms in and of itself while it's quietly damaging the body. So the only way to know really if you're slightly elevated is to measure your blood pressure properly with a cuff, or call into your pharmacy once in a while, call into a loved one that might have one of those at home, and to utilize it that way. So it's fairly common. It's a fairly common condition, which will become more apparent as to why that is shortly. So 1 in 3 adults have blood pressure, high blood pressure, and it's a major risk factor in heart attacks and strokes. So preventing and controlling that hypertension involves steps like eating differently, which we'll cover shortly, gentle exercise, avoiding tobacco. Smoking is one of the major triggers to hypertensive blood pressure, and managing your stress overall. So it's extremely common. Globally, you're looking at about an estimated of 1.28 billion adults with a B. So that's adults between 30 and 79. They have high blood pressure. So closer to home, the numbers are fairly striking, to be honest. In UK and Ireland, roughly 1 in 3 have high blood pressure. So to break that down, in the UK, let's say, about 31% of men and 26% of women have elevated blood pressure. So it's important to note that these particular percentages, they increase with age. So hypertension is common in older adults, but it's not only a problem for older people. And it's oftentimes kind of misconstrued as being a kind of aging-related diseases. And we'll start to see why that is, why it's construed that way, but it's a lot more nuanced than that. There are reasons why the diagnosis go up with age, but it's not just one of those, look, you're getting older, it's just bound to happen type of things. It's absolutely changeable and avoidable. So modern lifestyles, and it's kind of a blanket term, but modern lifestyles do have a huge part to play where high blood pressure is coming in. So we're looking at higher risk factors of chronically elevated cortisol, chronically elevated stress. We're also looking at the typical Western diet, and the Western diet typically would be highly processed foods, availability of products all year long that really, as human beings, we're not really hardwired to be able to have that constantly all year long. And predominantly it avoids things like meat, proteins, fats, and as a byproduct, we end up eating an awful lot more carbohydrates. So why does it matter? Why does it matter to have high blood pressure? So what, we say. It might be silenced, but its effects on the body are not. So uncontrolled hypertension puts extra strain on blood vessels and vital organs. So that can lead to really, really life-threatening problems, things like constant heart pressure on the heart, essentially. So it can cause the heart muscle to thicken and to stiffen, which can potentially, down the line, lead to heart failure. It damages coronary arteries, which contributes to heart attacks. And hypertension is responsible for about half of heart attacks out there. So where your brain is concerned then, high blood pressure is the leading cause of strokes. It can cause arteries in the brain to harden, to clog, and even to burst, which will result in a stroke. It's estimated to contribute to about half of the strokes out there. So long-term, there are impacts on memory, cognition. There's a link between hypertension and vascular dementia. So that's cognitive decline caused by reduced blood flow to the brain. So where your kidneys are concerned then, which is a funny one, because you think, okay, didn't really think the kidneys would be involved, but they are. So kidneys, tiny, tiny blood vessels are very, very, very sensitive to pressure. So hypertension can damage these vessels, leading to chronic kidney disease and even major kidney failure over time. With your eyes, high blood pressure can lead to, again, those really, really tiny blood vessels being damaged over time, which causes retinopathy. That can lead to vision problems. It can lead to blindness in severe cases. And then your arteries and circulation. So it damages arterial walls throughout the whole body. And it can make things like arteries less elastic and promote that kind of buildup of plaque. So it's known as atherosclerosis, which is a mouthful. So your circulation essentially worsens, and other arteries, like those in the legs, can suffer from reduced blood flow. So you might notice here, a few of the things I've mentioned are oddly similar to some of the diagnostic criteria and symptoms of insulin resistance. So here's your insulin resistance bingo card for me as well. I have to mention it at least once because it's tied into everything. So what is causing the high blood pressure, and why are certain symptoms like retinopathy, kidney difficulties, going to the loo more often, damages to the blood vessels in the urinary system, they're very, very similar to some of the first symptoms of type 2 or prediabetes. So for many people, it is a mix of a lot of different factors, but one major contributor that's identified over and over is excess insulin and insulin resistance. So insulin is a hormone that helps to control our blood sugars, but it also affects our blood vessels and our kidneys. So when a person has insulin resistance, which is common in metabolic diseases, prediabetes and diabetes, their body produces more insulin to overcompensate. So that high insulin level, known as hyperinsulinemia, can actually raise blood pressure through several mechanisms. So sodium retention is one of them. So insulin usually it signals the kidneys to retain sodium and water. So normally this is a small effect, but if insulin levels are chronically high over time, you end up with more fluid volume in the bloodstream, which means higher pressure on vessel walls. Think of it like overfilling a balloon. So your sympathetic nervous activity. So high insulin can activate that fight or flight response system that leads to tighter blood vessels, so vasoconstrictions and faster heartbeat. That combination drives blood pressure upwards. The insulin resistance will also be associated with inflammation and endothelial dysfunction. So that's the inner lining of blood vessels not working very well. So normally, insulin actually helps to dilate blood vessels by boosting nitric oxide, which is a vessel relaxant. But in insulin-resistant individuals, that beneficial effect is actually blunted. So instead, high insulin promotes growth in the muscle layer of blood vessels, which narrows them. So to put a kind of layman's term on that, the insulin resistance actually contracts your blood vessels, which is pushing the blood pressure up, and it stops the kind of normal function of nitric oxide, which would relax down that blood vessel again. So if you pinch a hose, the pressure of it goes up, and if you stop it from getting relaxed, it just stays at that level. So it's very common for people that are taking are participating in a low carbohydrate program or lifestyle to start to see their blood pressure start to normalize over a 4 to 6 week period. And that could be with individuals that have had blood pressure problems for years, that really they'll say, look, I'm not particularly stressed. Nobody in my family has crazy blood pressure, so I can't tie it to different factors. What is this? It's just purely a dietary and lifestyle factor of something underlying, which they weren't particularly aware of, was forcing blood vessels to contract. So most people that I speak to on a type 2 pre-diabetic program, over half of them will be on some kind of hypertension type medication like Ramipril. It's kind of a trifecta where there's high blood pressure, there's often high blood sugars, and oftentimes again there'll be some kind of cholesterol and dyslipidemia present. So that kind of triangle of conditions, which were thought of to just be comorbid, so as in they happen together. Who knows why? Of course, we know why, because the underlying factor is exactly the same. The root cause is the same across the board, and the root cause is that insulin resistance that's creating all these different problems. The three of those would be part of the trifecta, which would kind of signal metabolic syndrome. So it's that cluster, including abdominal fat, obesity, high blood pressure, high sugar, abnormal cholesterol levels. So how can that be counteracted? Well, very simply, it's by looking at that underlying cause and what is causing the insulin resistance. Rather than look at all of these things as separate, disparate things, what can we look at that's tying all of these things together that will help to improve blood pressure from the root cause, that will help to improve if there's difficulty losing weight, if you find yourself tired, if you find yourself with things like non-alcoholic fatty liver disease is in there as well. All of these different conditions, root cause of which would be looking at the foods that we eat. So foods can either help or hinder. Where blood pressure is concerned, foods can play a huge helping hand with getting it back down to levels that you're happy with. So a low-carb diet will focus on reducing sugars and starchy foods. So even starchy foods that, if you're a food pyramid aficionado, because that was the kind of, that's gone out with the flood, but that used to be the way that kind of public health advice for food used to be. So you'd have the food pyramid, at the bottom be things like whole grains, starches, rice, potatoes, wheat, buckwheat, rye, quinoa, all these different sources of grains. So grains in large amounts actually are hugely detrimental to the system, including things like porridge, including things like granolas. Whole grains are good in small amounts as part of a balanced diet. If they make up a huge part of your diet, all of these will convert down to glucose in the bloodstream. They do for everybody. So all of these different foods converting down to glucose will raise your blood sugar level. Your body will pump out some insulin. Happy days if it's in a small manageable amount. Now, if that's in an amount that the body is struggling to keep up with, it starts to pump out more insulin, then the body starts to get less sensitive to it, so it needs to pump out even more. And then you find yourself in the bracket where your body is becoming insulin resistant, as I'd mentioned. So the effects of that will be that tightening of your blood vessels, that signaling to produce more fats in the liver, more fats in the body, difficulty across the board with energy levels, inflammation. So it's that surplus of insulin that we're looking at. So whereas if we trace the chain back, where's it coming from? It's coming from a surplus of foods that break down to glucose in the system. So it doesn't mean that you have to cut them out altogether, not at all. It just means look at the ratio of the foods that you're having and whether they're benefiting you or hindering you. So by cutting out excess carbs, especially refined carbs, you prevent large blood sugar spikes and corresponding insulin surges. So over time, fasting insulin levels tend to drop, and insulin sensitivity can actually improve. It's not something that it's broken for life. That's it, you're scuppered. There's no helping you to the glue factory with you. Not at all. So it can be reversed. It can be made to feel that kind of insulin sensitivity again. So that can translate to natural blood pressure reduction. And as I said, that's within a 4-week to 6-week period is when you'll start to see a normalization of your blood pressure. So if you're somebody with very high elevated blood pressure and you are struggling to get it under control, cutting out things like bread, potato, pasta, rice, porridge, start there. That's a huge leap, and avoiding things like bananas, right? So they're the kind of main factors. Most high carb foods best to avoid, but just avoiding these or massively reducing your portion of those, the kind of yellow beige foods, will have a huge positive impact. It's going to help with weight loss as well. So low carb diets can be very effective for weight loss. Due to the appetite regulation that comes from it. So you don't tend to feel as hungry when your carbohydrates are reduced, which sounds kind of counterintuitive, but that's the way it is. It levels out your hunger hormones and your satiation hormones. So on average, for each kg of weight loss, systolic blood pressure drops by about 1 mmHg, right? So it tends there's a systemic trend there that they correlate with each other. So many people with hypertension will lose significant weight when they see their blood pressure come down as a byproduct of cutting out carbohydrates a little bit more. So metabolic health overall is going to improve hugely. So beyond just weight loss, low carb nutrition will help to improve your triglyceride count, which is one of the components of cholesterol. It'll raise your good cholesterol and it'll lower blood sugar and inflammation across the whole body. It'll help to heal that endothelial inner lining of the arteries and make blood vessels more responsive and able to relax a little bit better. So this will also help reduce fatty deposits in the arteries over time. All of these will reduce the strain on your cardiovascular system, basically. So what you're looking at is a whole body systemic improvement in your cardiometabolic markers. So if you're looking at heart health, one of the greatest predicators of keeping yourself safe from cardiovascular disease is avoiding high spikes in blood sugar levels. Diabetes is a greater impact to cardiovascular health than anything else out there. So trying to stay with your HbA1c, that number that predicates where you're on the line of normal, pre-diabetic, diabetic, you want to make sure that that is staying really within the normal ranges while making sure that the blood pressure in your blood vessels is kept at a healthy level by not having those mechanisms that are squeezing the tube and stopping it from relax out again. So different things. So different additional things can help out here. So getting your stress levels down is going to be huge anyway, because wherever there's kind of chronically elevated cortisol levels, that's going to have a byproduct to both your insulin levels and your body's mechanisms of how it processes stress. So processed stress can also, have an impact on blood vessels. It can boost your body's production of blood sugars as well. So in a high stress environment, the body will produce glucose from its own kind of makeup to help you in the event of having to fight or flight something coming at you. The other thing that you can do is get a good dose of potassium. So people just think of bananas, forget the bananas. Bacon's a great source of potassium in there. So high potassium diets are consistently shown to be associated with lower blood pressure. So you're thinking things like leafy greens, broccoli, avocados, nuts, salmon, yogurts. They're all going to be brilliant sources of potassium. So potassium-rich foods, the more that you have, the more it's going to help the body to regulate its sodium levels, its urinary functions. So all of these are absolutely brilliant. You want to make sure that you're getting a little bit of low impact exercise, things like walking. And this is especially brilliant if you time it in accordance to when you've eaten. So about half an hour to an hour after you've had your main meal of the day. If you go out for a 15 to 20 minute walk, more if you can, would be absolutely brilliant. But good timed walks, low impact exercises are going to help to reduce blood pressure hugely. So being moderate with your alcohol intake, that's going to be a kind of no-brainer. So drinking too much will bring up your blood pressure as well. So if you drink, do so in moderation. That's up to about 14 units per week, give or take, and usually better done over the week and not just in the one Saturday night. So all of these kind of lifestyle factors, managing your sleep, other major one. So chronic stress and sleep cycle disturbances. When we're stressed, our bodies release hormones that temporarily will raise your blood pressure. So over time, constant stress can keep your blood pressure elevated. So on the inverse, keeping your stress levels down is a huge benefit, and that involves getting a good night's sleep, whatever is most possible for you as the next best thing. If you're having very poor sleep patterns at the moment, just aim to get about 20 minutes extra in the evenings, and do that over a series of days or weeks to make sure that you're incrementally going up. Because the other key factor is the more stressed you are during the day, the more your sleep is going to be impacted at night, because your body's releasing stress hormones, adrenaline, cortisol, that are telling your body it's not safe to go to sleep at night. So if you have very poor sleep, a great place to start is managing your stress levels over the day. Now, one thing that I usually tell people is, if you're in a scenario that your stress is impacted on a day-to-day basis at huge levels, that you find yourself a little bit trapped in it, there's not much that you can do. So the first thing I'd say is there actually something you can do about your stress level? Because oftentimes we tend to think, no, there isn't. But thinking outside the box a little bit, can I ask for a little bit of reduced hours? Can I let HR know that I'm under a huge amount of pressure and I need just a little bit of breathing room? Can I let my friends and family know that I need a little bit of breathing room? Oftentimes communicating that and allowing yourself to take a bit of breathing room is the first step with it. If you find yourself in a situation, be it moving house, whatever it may be, that it's tied a little bit more, that there's a very finite period where stress levels are going to be up a little bit, doing things like taking even 20-minute increments throughout the day, that you give yourself license to take that time for yourself. It is nobody else's. Put your problems down for those 20 minutes, put them in a safe box, metaphorically speaking. Tell them you'll come back to them in 20 minutes, and just take an oasis of time throughout your day where you put those things down. You will come back to them, but this is a 20-minute holiday from these thoughts. That done 2 times, 3 times during your day means you've got a whole hour where you're allowing your system to just regulate, to come back to balance, to come back to itself. Using relaxation teas, although for many, they're seen as this kind of, small line of defense. They're not going to solve, your work issues, your life issues, and thinking of it that way won't help. But if you're already looking at the factors where stress is elevated and utilizing those as well as a complement to what you're already doing, they're brilliant. So getting the stress levels down over the day in very small, manageable ways is going to help your sleep. When your sleep is positively impacted, it's going to have a positive byproduct where you're not going to be craving high carbohydrate foods. You're not going to be craving high sugar foods, which are oftentimes craved when we're sleep deprived and stressed. So in all these different ways, in all these very small ways, you're looking after yourself, you're looking after your blood pressure, and making sure that you have a way to get a baseline with it. And this is something I'd say to most people that are interested in starting to look after these aspects of themselves, is make sure that you can measure it. Get a baseline for yourself, see where you're at, and get yourself in the headspace where you set an intention to start to bring that down within that 4-week period. And remember, it takes a little bit longer to start to see the blood pressure regulate back down. So give yourself a good amount of time to start to see that, but set yourself a goal as well and measure it fairly evenly once a week. Make sure that you're keeping an eye on it, particularly if you're somebody taking Ramipril or any of the other medications for high blood pressure and you're bringing in the kind of low carb lifestyle, making sure that you're looking after that in a way that it's not going to drop. It never is. It's not going to drop in any way that's scary or anything like that. But making sure that you're keeping an eye on it as it starts to come down week by week. Right. I hope you found that helpful with the old spotlight on hypertension, and that you have a wonderful rest of your week. That is me for today, and all the best, and we chat to you next week. Bye now.